forward to their opposite hand, and we try to bend into it as a nice isometric contraction. If that gets too boring for a patient, sometimes I'll have them do it at different angles. I'll have them do it a little bit with a little more extension, maybe around 90, a little bit higher, so it's a little bit more dynamic for them, but it's still an isometric. But it works the elbow flexors in a different angles, varying degrees. You can do active assisted range of motion with your opposite hand. You can use a wand or a cane like we did last week. You can use your other hand to help assist gains of motion. And then, of course, if we want to just generally work on range of motion, we can do some active contraction of the biceps to work on the flexion as well. As we progress to strengthen, we can start to use light weight. And again, the position of the forearm can bias or emphasize the muscle that we need to work for the person's functional use, their work, whatever's meaningful to them. If it's typing, I might work on the forearm pronated. If it's driving, maybe I'll work in a little more forearm neutral. If it's carrying heavy trays or children, I might work in a little bit more supination. Whatever the case may be, we customize it to their needs. But I can use a light weight to emphasize biceps, brachioradialis, or brachialis, and then I can use an exercise band also to do the same kind of thing, right against resistance. Again, keeping in mind that I can either increase or decrease the tension that exists in the band, or I can double it up if I want to make it harder. We can always modify the band. You can do PNF diagonals to incorporate some strengthening of the elbow flexors, as we talked about earlier today. And then, for more advanced, it says reverse action elbow flexion. That would be one of two things. That would be like a pull-up. That's a reversal of muscle action. So instead of bringing something up, we're holding on to something and we're bringing our body up to the wrists. So there's a little bit of a reversal of muscle action. So you can do pull-ups with the palms facing you in supination that emphasizes the biceps. Some of the pull-up machines where you have assisted or weight assistance allows you to hold in a more neutral position, and then some people do pull-ups with their forearms pronated, and that obviously will emphasize the brachialis more. So you can do reversal of muscle action, and the other thing you can do if you're at a gym, if you have some kind of a rack, like a Smith rack or a bench press rack, you can actually hold on, and you can pull your upper body towards the bar. So it's basically the same kind of thing, but your body is a little bit more of an angle. So that's more of an advanced reverse action of the elbow flexors. And again, keep in mind, you're having someone pull their body weight upwards, so it can be very demanding. It's only for higher level clients. And then we talked about using the body blade. So the body blade is a dynamic stabilization exercise where we have someone do something, and the elbow is basically it's not quite isometric, it's a very short pulsing motion, but everything is required to be in a very tight position. It's a quick contract and relax motion, and it does involve working the elbow flexors, depending on how you perform it. If we want to work on gaining strength and extension, again, we can do isometrics. Sometimes I'll have a patient just put their forearm up against the wall and just press. You can have them sit in a chair, and they can press down into the table. Try to straighten your elbow down to the table. They can obviously resist with their opposite hand. Push down into your palm with your fist to work triceps isometrically. We can have them do active assisted range of motion. You can have them do it in a gravity eliminated plane. So you can have them, I have the table a little bit higher. You can do some active assisted. You can help with your opposite hand. You can work with the cane. Okay, so you can use your other hand to help push the other elbow into extension. Okay, so it's a little bit of active assisted. And then you can do active range of motion. Typically, you're going to be most effective if you put them in the test position. So I'll either have them lie prone and work as we did in the test position for the manual muscle test, if they can't tolerate prone, typically I'm going to have them try to do it in this position. So they're keeping their humerus stabilized, and they're basically working against gravity in this position. So it's a little bit different, but this would be another way to do it for people who can't tolerate lying prone. And then the progression to be more intermediate would be doing the same thing, either in the test position or supine with a weight. Okay, so you can have them do tricep press here. But I think most people prefer to do it here. Okay, so they can do it here. In supine, shoulders flexed about 90 degrees, and I'm basically controlling the extension against the weight of gravity. It's very important that they stabilize the humerus with pillows or using their contralateral hand. And then we can do PNF resisted diagonals, emphasizing elbow extension if we want to work the triceps a little bit more. And then for the more advanced, the body blade works great. And then can anyone think of a good reversal muscle action to work on elbow extension?
Push-ups.
Okay, push-ups are good. What's another one that you see at the gym?
Dips.
Dips, you got it. So push-ups are great, and then dips are, the one where we lower our body weight and allow our elbows to go into an eccentric contraction, and then boom, they bring our body weight up, and our elbows do concentrically contract to move our body weight.
Hey Brian,
Hey, what?
could the seated dips be considered like a mid-range, like an intermediate? I guess it could, right?
It's pretty advanced, I think.
Seated dip?
It's up to you. I mean, I like, Beth and I think that the muscle, or the intensity of exercise correlates with a certain muscle grade. So if you have a need for a basic exercise, your muscles are going to be somewhere between like a 2+, 3-, and like a 3+. So somewhere in the 3 range, plus or minus.
All right.
For the intermediate, it's going to be about a 4, plus or minus, and for the advanced, you're going to be close to a 5, or you're going to have a very specific functional or sport-specific need that you need to rehabilitate them at that high level. Most of the time, if they're doing advanced exercises, it's for a short period of time and you're transitioning them to an independent home exercise program. You're preparing for discharge. And so, again, the nice thing about being a therapist is that we understand the human body and we understand leverage and biomechanics. We can always modify something to make it easier or harder. That's the nice thing. If dips are too easy, we can suspend a weight from their waist, from a chain, and have them do dips harder. If it's too easy, or if it's too hard, we can have them start by just doing some chair dips. I'm going to have you find a chair with some armrests. I'm just going to have you do dips in a modified range. That would be more appropriate, I think, for someone who's intermediate.
Yeah.
We can always modify everything to make it patient-specific and make it so that it's an appropriate challenge given their existing precautions, their muscle testing grades, and their functional needs. Last thing, forearm pronation. Of course, we can do self-applied or therapist-applied isometric forearm rotation. We can use the weight of the hammer not only to gain motion, but also to generate force. So if you have a cane like that, you'll appreciate that if you hold it at the end, you will get a stretch, you'll get some active assisted range, but you'll also, if you turn it back and forth enough, you'll also activate the muscles, and you can strengthen them as well. And then to strengthen the forearm in the clinic, we do use the body blade. There are some specific exercise tools that work, forearm supination and pronation. One thing in particular, I don't know if you've ever heard of it before, it's basically called a flex bar, and it's a long, broad piece of rubber, and it's flexible so that when you grasp it, it kind of simulates if you were wringing out a wet towel, that kind of motion. So you're kind of doing this, you're kind of wringing. It's a wringing motion. And so, I don't think we have any, but basically they're long rubber dowels, and they have some resistance, and they're different widths, so you can work on functional twisting which works the pronators and the supinators a bit. If they don't have that at home, or they don't want to buy anything, I will literally say, get a hand towel, get a small bath towel, put it in the sink, and just gently work on wringing that out to work on your pronation and supination as a resisted exercise. You'll find that there are some people who will do anything to get better, and if you recommend something, they'll go on Amazon, they'll buy it, and they'll use it for their home exercises. There are other people, who aren't so keen on buying things. So you have to come up with ways to recreate that resistance without the equipment that you may have access to in the gym. So that's one thing that I do, is I just have them use a wet towel in their sink, work on wringing it out. So, again, take-home message for you guys is that we're mostly going to have you focus on elbow strengthening and stretching for the purposes of our final exam. I think it's important to pick a couple of good quality, solid exercises and stretches for your exam. And remember, you will have access to TheraBand and light weights for your exam when you instruct the patient in their exercise and their stretch. So like we said, we're kind of ahead of ourselves. We're 3 weeks ahead of ourselves. But you'll have to do a stretching exercise with your patient. You'll have to do a strengthening exercise with your patient. And you'll have to do a PNF diagonal or some intervention, contracture that stretch, whatever the patient needs. So remember that. So start to think about how you can incorporate these for different, with people with different impairments, and which exercises might be the easiest to do when you're on the spot, working with someone in a short period of time.
Is there going to be cervical? That's what you're asking.
Say that again?
Is there going to be any,
So the two cases you'll see, we'll go over this in detail starting next week and then the following week. The cases will be either thoracolumbar, cervicothoracic, shoulder, or elbow. That's it, I think. So there's no scapular stuff. There's no, other than maybe a little bit of posture, there's no forearm, wrist, and hand. And there's no TMJ. All that stuff's fair game for your board exam. That's why we have to go over it. But as far as our clinical insight leads us to believe that you would be best suited to practice and be prepared for the joints that you'll see most often, which are elbow, shoulder, cervical, thoracic, and lumbar spines. Any questions? Okay. We have a couple of questions to answer in our lab manual, chapter 11, 3 through 8. Let's do those in small groups. And then if we have any time to practice PNF diagonals before Beth scribes them, we'll do